pursuant to Chapter 2 of the Acts of 2023, an act relative to extending certain COVID-19 measures adopted during the state of emergency, signed into law on March 29th, 2023. This meeting will be conducted via remote means and in person, as long as members of the public can easily access the proceedings in real time and participate remotely. Until further notice, this meeting will no longer be broadcast live, but may be watched when the show is replayed on YouTube. Members of the public who wish to participate in the meeting may do so in the following manner: in person at the Rope Walk Room located in the second floor at Plymouth Town Hall, 26 Court Street, Plymouth, Mass. Note that the occupancy limit of the room may reduce the number of attendees that can be accommodated. I don't know the occupancy limit, but we have a full house. I should also announce that there has been earlier this week, apparently, an order put forth by the governor that for the foreseeable future, until the legislature acts, the meetings will continue to be held hybrid and or remote, or in person. We thought it was going to expire April 1st, but apparently it's been extended. So again, we're going to run the first item the first item we have to go through is approve the minutes from the 5th of March. Does anyone have corrections or changes to those minutes? Have to read anything?
I was not present.
Okay. Amy, do you have anything for those minutes?
Nope.
Okay. Lorenzo, do you have anything from the 5th of March minutes?
No changes.
Okay. I have no changes either. So I just need a member of the Board of Health to make a motion to approve the minutes as presented.
I so moved.
Is there a second? I guess it's either Amy or Lorenzo.
I'll second it. Barry, you just went quiet again. Oh. Yep, not hearing anything.
What about now?
Now I
you
can
hear
hear
me?
you. Yep. Okay, good.
It's, yeah, it should be coming out of this. It's not, but that's okay.
Okay.
All right, we're good. Yep.
So if anything else happens and you can't hear any of us,
Oh, just happened again. It looks like on Margaret's, it looks like it keeps being muted and unmuted.
It's unmuted.
Yeah,
Okay.
they're. Okay.
Yeah, I don't know why it keeps muting spontaneously.
should I turn my audio feed on from my computer or is that?
No,
gonna-
let's
or is that
continue.
gonna- So we had a motion to and seconded to approve the minutes from the 5th of March. And so I just have to call the roll. Amy, yes or no?
Yes.
Lorenzo, yes or no?
Yes.
Dr. Reed was not present for that meeting, so you can vote or you can abstain. You abstain. And I vote yes also. So the minutes are approved from the 5th of March meeting. Next.
Barry, I'm sorry, Barry, Deb's here too. I don't know if you see her.
I didn't notice there's so many people.
Yeah,
on
she
the-
popped in a little later.
I was not at that meeting, so.
Okay, so you
Thank
will
you.
abstain also, Deb. Thanks for letting me know that Deb was appearing in one of the little boxes. For those of you who are actually joining us remotely, if you wish to speak, you'll notice that at the bottom of the screen, there is a little button that says react. It's the third one from the left. If you push that and you see a little orange hand appear, we will see that on the screen and then we'll know that you're waiting to speak. So our first items of business are actually 5 restrap variance requests.
Yes.
I guess the first one on the list is Plain Jane's. Is there someone here to present that?
Yeah, come up here. That'd be great. Thank you.
Yeah.
Join us at the table.
Okay, sure, thank you. Oh, thank you.
And you can present your request for variance.
I don't know how about going to do that, but I would like a variance for the grease trap. for the renewal of the grease trap. I've had my existing grease trap for 5 years. And it's always been maintained. I have an outside grease trap, 1,500 gallons, and the inside one is 40. And, the system has been working well. I have it maintained, both of them 4 times a year. And, I was hoping that I could just get a variance where it's fairly new,
Okay,
yeah.
does the department have recommendations from the other departments that are involved?
Yes, absolutely. So, just as Jane had stated, there is a 1,500 gallon grease trap outside. And the regulations do say that it needs to be a 2,000 gallon grease trap. But, the team did take a view of the property and inspected. And they recommend approve both engineering, plumbing, and public health. Recommend that the board approve the variance. The restaurant has a 1,500 gallon external as well as a passive internal. We, at the department, would request that the external be pumped quarterly, which I think you're doing
Yeah.
anyway.
Yeah.
And the internal should be pumped monthly.
Oh, monthly?
Mhm.
Oh, I didn't know that.
Yeah,
Okay.
that's the recommendation. If the variance is indeed granted, we would want that to happen.
Oh, okay.
Yep.
I didn't know that. Okay, yeah. I have a new company too, and so they're more local. The other one was from Bill Ricker.
Ooh,
Oh,
This-
that's a long way.
But I couldn't find anybody at the time. And then all of a sudden, this name come up, Bay State from Lakeville.
oh, good.
And so, yes, he's a really nice guy. So yeah, I'll let him know. I think he just did it 312. And the one outside was 220.
Okay.
So we'll get it done this month, I guess.
So they both have to be pumped?
Just the
On a
inside one,
monthly
you said,
basis,
right,
on
Karen?
one side.
Yeah, the inside monthly, externals quarterly, which is already what they're doing at their location anyway. The only change is that we would request that if the variance is granted, that the internal be pumped on a monthly basis.
Okay. Amy, do you have any questions for this applicant? No? Lorenzo?
No questions.
Okay. Dr. Reed?
No questions.
I have no questions either.
Okay.
So I just need a member of the board to make a motion to approve the request for the variance with the condition that the internal grease trap be pumped monthly.
Okay.
Yeah.
I still move.
Is there a second?
I'll second it.
Amy seconds the motion. Is there any further discussion? Hearing none, I'll just call the roll once again. Amy, yes or no?
Yes.
Lorenzo, yes or no?
Yes.
Dr. Reed?
Yes.
Myself, yes.
Yes.
Oh, and Deb.
Yes,
So, four full members and one alternate member vote yes, and one member is absent.
Will I get a piece
I'm
of
here, the one from Ocho
Fine.
Cafe.
the Gloria's request that I got it
We
approved?
can send you, we'll send you an
Oh,
email.
okay.
Yep.
All right. Well, thank you so much. I
You're welcome.
appreciate it.
All
Yeah.
right,
Yeah.
good luck.
We love playing Jane's.
Oh.
I have friends who are pilots and they love to go there.
Yeah, well, I'd love to have it come. Thank you guys so much.
All right.
Take care.
Bye-bye.
Thank you.
Then there's Ocho Cafe, Virgo,
Sergio?
Sergio?
Sergio here from Ocho?
is he online? Let's see,
Sergio from Ocho?
there's so many, you can't even see the bottom one.
He's muted.
Is anyone online here for Ocho Cafe?
Yes, I'm here on this Zoom.
I don't know who's talking. Okay,
With there's one on, there's a couple on the phone.
oh, okay. All right, so someone is here from Ocho Cafe. So Ocho Cafe is located at Colony Place. They have requested a variance very similar to the last one that you just heard. They have a 1,500 gallon exterior grease trap. They're asking for a variance to keep the 1,500 instead of
Correct.
having it for 2,000. Right? Okay.
Is
Not
that him in
sure.
the upper right
That's
box? I
Sergio,
think
yeah.
so.
Sergio, are you there?
I'm here. I barely can hear you. It's like cutting a lot. I don't even know why. I'm sorry.
Okay, okay. Maybe if you want to adjust the volume on your computer, but in the meantime, is it okay if I just go ahead and kind of read what you're requesting?
Correct.
Okay.
Yeah, that'll be awesome. Thank
Okay. Again, the team went out and inspected, the sewer division, engineering, plumbing, and public health all agree to, that they would recommend to approve the variance. That there is a, very clear record that Ocho Cafe does have their system pumped and maintained regularly, which is always good to see. The one thing that we would recommend, though, is not connect the bar sink to a grease trap. So that's just a little aside note. Do not, Sergio, do not attach your bar sink to the grease trap.
you. Okay. Yeah, I'm not sure. I don't think it is, but I can double check that.
Yeah, just double check. That's the only note that we had.
Okay.
So
Yeah, that's
the
not a
team
problem.
approval.
Okay, thank you. Does anyone have questions? Amy, any questions?
No questions.
Lorenzo,
No further questions.
Dr. Reed?
How often are they emptying it now?
We do the inside monthly
Monthly.
and the outdoor every 3 months.
I'm sorry, every 3 months, every 3 months. Yeah. And that's regular. That's what it should be. Yep. Yeah. So even though it's a smaller gallon size than what the actual regulation states, it is being maintained, it's regularly emptied, and it's not going over. So we're saying that the amount of grease that's being generated is the 1,500 gallon is adequate.
Okay.
Deb? Any questions?
No.
I think I saw you take your head, no?
No, no questions. Thank you.
I have no questions either. And would someone make a motion to approve the requested variance?
I saw,
I'll second it.
I don't know.
No.
No conditions?
Oh, just the bar sink. With
Oh, the
that,
bar
we
sink,
could,
we
yeah,
already
we could
know.
follow that. Yeah.
Okay, so the motion's been made, is there a second?
I'll second it.
And I'll call the roll once again, Amy, yes or no?
Yes.
Lorenzo, yes or no?
Yes.
Deb,
Yes,
Dr. Reed?
yeah,
Myself, yes, it's unanimous. The variance is granted, thanks very much.
Thank you.
Thank you.
Thank you.
And then we have two separate grease trap variance requests from Wendy's, one on Long Pond Road and one on 45 Commerce Way.
Yes, the owner is the same.
So I guess the one owner can do both.
Thank you. Osama Sahrawi, I'm representing Wendy's, my partner sitting here, Terry Smiley, and CFO, Josh Levine. And we're just asking for variance. We're maintaining our grease trap internal monthly. And we are maintaining the outside grease trap, 1,500 gallon every 3 months. And we also have a grease extractor, which is extract the oil directly from the fryer with the touch of a button. It sends the oil to a tank and it get hauled away from the restaurant. We have alarms and we make sure we never go over it. So we have a very good system. We also keep a record of all the pumps. We keep in pictures of when they clean the traps. They have to give us before and after. So we feel like we would like to have a variance because also the space is very limited there. To try to put Big Dipper under the sink with what the plumber in, and we talked to the plumbing inspector as well. And it's unserviceable. You're not being able to service it. If we would, so,
And the system is the same in both locations.
correct,
Yes.
yes.
Yeah.
Okay, thank you. Karen?
So as stated, both of the Wendy's have a 1,500 gallon external grease trap, which is a similar theme tonight. And they also have a direct connect grease extractor for 1,200 pound capacity. They've been keeping their records. They're well within their grease trap cleaning. Their records are fine. So the team, both engineering, plumbing, and public health, do recommend approval of both of these locations. The standard kitchen design certainly does have space restrictions. there really is no room to fit what we would recommend to be the Big Dipper for an internal, automatic. So, the team recommends that the board grant this variance based upon what is currently there and how well they've been maintaining it.
Okay, thank you. Any questions, Amy,
No questions.
Lorenzo,
No questions.
Deb,
No questions.
Dr. Reed,
No questions.
myself, no questions. So we just need can we make a motion to approve both at the same time?
Absolutely. Yep, both.
So we need a
Yep.
motion to approve both locations for Wendy's for the variance request. Dr. Reed, next motion, is there a second?
I'll second them.
There's a second made. Assume there's no discussion. If there is, please yell at me. So I just call the roll once again. Amy, yes or no?
Yes.
Lorenzo, yes or no?
Yes.
Deb?
Yes.
Dr. Reed? Myself, yes. We're a very agreeable bunch.
Great, thank you very
It's
much.
approved. Thank you.
Thank you very much, appreciate it.
Thank you.
There's one remaining variance request from Yellow Deli, Zachary Mass. Well,
don't mind.
here's somebody giving you a seat.
My name's Zachary, representing the Yellow Deli, and this is Ken Hart. He's the plumber,
Oh, okay.
on the building there, worked closely with Doug. So we're applying for a variant. We don't have an external grease trap due to space restrictions on the property. And elevation with the sewer and the street, it didn't work. And that was all approved when we did the building. It's new construction, about 4 years old. We put an internal grease trap, 300 gallon in the basement. And that all goes into a pumping chamber. And so if you looked at our menu and what we serve, we have no friolators, and no grills. We don't do anything with grease in that way. The only thing would be soups. We make a little bit of soup, like on in a steam kettle, and do some baked goods. So our menu is very grease deficient, you could say, in that way. We have a pump chamber in the basement that before it goes out into the city sewer, that periodically check. I've personally checked it many times and never seen any grease in it. If there was grease in the system, it would be in that pump chamber. 'Cause it's a large holding tank.
It's a double pump chamber. It's expensive systems. We look at it to make sure that nothing's wrong.
And so we did not regularly have our grease trap pumped due to a miscommunication. We had signed up with for a contract, and I guess they never showed up. And when I found out about 4 months ago, this was after being open for a couple years, I immediately got it pumped, and the man said it wasn't crazy how much was in there. Said it was kind of average. And that was after quite a while of being in business. And so I immediately put it on a quarterly schedule. And he came back recently after 3 months and said there wasn't a lot of grease in it. So that's our situation. I don't know what we all think about it, but
I'll see if anybody has questions. The same company that was being used from Lakeville,
no, this was Wind River.
where are they located?
It's probably the Billerica company. It's a big company, in eastern Massachusetts, but I don't know exactly where they're located.
Yeah, okay.
I think they're in the Hanover area.
You know?
So in Hanover,
Yeah, you see them off the highway. I think that's where they.
Mhm.
that's nowhere near as far as Billerica. Karen?
So, what, they presented is indeed correct. It's an indoor, a little under 300-gallon grease trap. No external grease trap. The team went inspected, they all of them, sewer, engineering, plumbing, and public health, do recommend that the applicant install an automatic grease trap, especially because of the 3-bay and the dishwasher. They can keep the passive interceptor in the basement, that should be pumped monthly. But, the team does not feel that it's adequate, that they really do need to install the automatic unit on a 3-bay in the dishwasher, which does not exist right now.
Okay. Have you considered putting in an automatic?
We have talked about it, not recommended by our plumber.
Why is that not recommended?
Well, we have epoxy floors in the building. I don't know, we'd have to remove the epoxy floor, which I don't know how we're gonna do that. And then the walls are all stainless behind it. To get to the venting part of it. We ended up dismantling the entire kitchen, put this big dipper in, which I'm familiar with. They were in Connecticut, my master in several states, they were in Connecticut before that. They with the grease interceptor. Our main argument is if what we have is way over. Excuse me if I say way over. You can see the amount of grease, even at that time that maybe they didn't pump it as much as they needed to, you see the amount of grease was not much at all. Now quarterly in a 300-gallon tank, you've got 2 or 3 inches of grease. That's our argument, is we're not producing a lot of grease. If we were, and we were harming the sewer, for sure, you gotta do something about it. We don't feel that we're producing that much grease, and that's why I don't think we need to do it. We can, if you like, you wanna put us on maybe a 6 or 8 month trial, we'll show you the records. I don't think 3 inches of grease in a 300-gallon tank, in our opinion, is much. You know what I'm saying?
Recognizing exactly what you're saying, and I know the team also heard, exactly what you're, saying to us as well. But what the team would say is this: your location is in a very precarious spot. It is in the middle of our downtown area where we have had a situation with grease before. We implemented these fats, oils, and grease regulations so that there would not be a catastrophe, so that we wouldn't have a Fogberg situation where, if something like that formed and the grease and the waste went up to the Fogberg, it's not gonna just stop there, it's gonna go back to where it came from. But it's not just gonna go back to your location, it's gonna go back to the restaurant next door to you and the restaurant across the street and everyone else who's hooked up in that area. So in order to avoid something like that happening, we implemented these new, some people would say, quite comprehensive fats, oils, and grease regulations, but that's the reason why. Because it would be catastrophic, not just for you, but for everyone else in that area, should something like that actually happen. So in order to prevent that, that's why we're making these recommendations.
We understand that. That should, I agree with that. But if we're not producing that much grease, right?
Well, I've already stated what the department, I'm the department.
Yes.
This is the Board of Health. So I've already stated what the department is recommending, what Sue is recommending, what plumbing is recommending, what engineering is recommending. We're all recommending the same thing. But the board is here to hear your request for the variance. So they're the folks that may have some questions for you.
Okay.
Yeah, thank you, Karen. Thank you.
Yes.
Amy, do you have anything? No, Lorenzo?
So the establishment, when it was started, would have had to comply to the standards, right? Of having this grease trap 1,500 gallons. Why didn't they have that, or were they in place or the establishment started before these standards were in place? Can you walk me through that?
When we applied for the permit and we began construction, it was realized quite quickly that there's no actual location on the property for a tank like that. And so we, between the plumbing department and the health department, it was agreed upon to, rather than installing that exterior grease trap, to install it over a large one inside. So it's actually like a oversized grease trap inside the building, recessed in the basement floor.
We would gladly have put it upside there, and we had engineered plans for that, but then we looked at the inverts on North Street, the sewer is quite high. And right away we realized it wasn't gonna work. So that's.
There was approval
Yeah.
from DPW, plumbing and health department at that time.
Yeah, so again, totally recognizing that an external is not gonna work there even now, then or now, an external is not gonna work. The difference is that we're requesting that you do an automatic internal, and that's why, and that's what when I say team, I'm talking sewer, engineering, plumbing, and public health, that's who comprises the team. And that's what we're asking for, that we recommend to the board, again, they're the decision makers, that you do have an automatic internal. Totally agreeing, an external would not be possible, for many reasons. But that we would like to see an automatic internal application.
If I can follow up, yeah. Well, my follow-up is, when was that agreement, that initial agreement between the Plymouth entities that would have given you basically the permit to operate your business?
The initial agreement would have been in 2015 or 16, when we were actually doing the underground construction in the basement. That's when the agreement was made. We didn't actually open until 2021.
Okay.
But during the construction of the building is when that agreement was made.
And then for the department, within the regulations, it talks about, and I'm just pulling this regulation, I was just looking at this, inspections. Do we inspect on a yearly basis, the cleaning and maintenance records of the grease or oil remover? Do we have that records for?
Establishment is twice a year. And
It's
they have
twice.
to present records that if it's a non-automatic, it's monthly, and if it's automatic or external, it's at least every 3 months. And they have to produce those records during the inspection, which is at least twice a year.
And they've been in compliance of that, or have
Yeah.
not?
They have.
Okay.
Yep.
And so if this variance wasn't provided, what is the impact? You have to install something in the building, right? In the basement?
Right, they would have to put in, if the variance is not granted, then the yellow deli would have to put in an automatic internal grease trap for their establishment.
Would they
And
have to be,
And
I'm
again, we're
sorry,
not looking at it, I think it's important to say that the department isn't looking backwards, we're really looking forwards. And we've been talking, and these regulations went in place almost 3 years ago. So we're not saying to any establishment, you're not doing a good job, but what we are saying is that we have to prepare for what could happen. And in order to make sure that it's not a catastrophic failure of the system, these are the guidelines that we have implemented.
yes, I understand that. So if they're not in compliance and this variance is not set, what does that happen in terms of their operation of the business? They have to be in compliance in order to operate, or would they have to shut down until this is done?
No,
Okay.
no, I would not. There are other, food establishments that we're also working with, that need a little bit more time, and we're certainly working with them. So we would do the same thing here. My goal is certainly not to close any establishment because they're working towards this goal. What would happen, however, though, is that if a food establishment has never reached out, has never upgraded,
Mhm.
continues to ignore phone calls, emails, and letters, then I do have the capability and the authority to close that establishment until the grease trap's brought into compliance. This will not happen in this situation because you're here and we're working on something together. You're requesting a variance from the board. They're hearing your statements. So that note, Lorenzo, to answer your question, I would never close the establishment who's trying to work on something together.
Okay, thank you.
Okay, Deb, do you have anything to ask?
Is there an issue with putting in the automatic internal? Like, is there not space for it, or?
It'll be a very difficult job to do, very costly and very difficult. And that's why we're saying if we're not producing large amounts of grease, that we're hoping that would be a big consideration, and that's why we're here. It was something simple and easy to put in. Even then, we just don't feel that we're not harming the sewer system by the amounts of grease that we produce. That's really our main argument. Even the grease trap we have in the basement, it's quite a size for what we have for sinks in there. And that's our main argument, is just we're just not producing that much grease. If we were, and what Karen's saying, for sure, you have to do your job. We understand, we have to protect the system. But that's our main argument, really, honestly, not producing that much grease.
To answer your question, more specifically, it's possible to do it. It's just a large undertaking, given the way the construction was done, and the finishes. If you were to see the kitchen, I mean, most inspectors that come through our kitchen say you could eat off the floor. It's just, everything's pristine. And so it would be a large remodel to open up the walls. All our sinks are custom built, fit to the wall. It's a large project for us. That's why it's of significance that we're even going this far to request the variance.
And do you do breakfast, lunch, and dinner, or just breakfast and lunch? Or what,
We're open 24 hours a day.
24 hours, okay. All right,
We don't have a breakfast or a lunch, like a specific menu for those times. It's all the same, but we're open.
okay, thank you.
Dr. Reed, do you have anything?
I don't think so.
I think at this point then, all the questions that I could think of have been answered. It seems to me that the team, which is made up of experts that handle this for the town, should be able to, work with you and try to find a way to get around the issues that have been identified. Maybe it's going to be expensive. Maybe they can come up with an alternate sort of way to deal with it. But I'd be very reluctant myself personally at this point to go against the recommendation of so many town officials that are involved in maintaining the sewer system and making sure that there's not a blockage that may be contributed not just by you, but maybe grease from other locations. So that would be my feeling, but I think we should at this point ask a board member to make a motion to grant the variance. And the board members can then either vote for or against it. That's about all we can do. Would someone like to make that motion?
Also,
Dr. Reed makes the motion. Is there a second?
Yes, there's a second.
Lorenzo seconds the motion. Is there any further questions or discussion about this? Hearing none. Amy, yes or no?
No, I don't grant the variance.
Okay, Lorenzo, yes or no?
Yes.
Deb, yes or no?
Yes,
Dr. Reed?
Yes,
Myself, no. I believe there was 3 in
Yes.
favor and 2 opposed.
You got the variance.
Okay.
Thank you.
You're welcome. That was a tough one.
Mhm. It is, so many factors, different factors, yeah.
Next on business is possible Board of Health response to select board and town managers' concerns concerning the Board of Health. And it is a vote anticipated. Those of you who may not know, at a past select board meeting, I believe David Golden, who is also joining us remotely apparently, had a discussion with the town manager and presented quite a long list of things that he felt that the Board of Health had passed or was considering passing that would have resulted in more bans. It turns out when I reviewed that and I reviewed the comments that Mr. Golden made, a lot of them were discussions which were never intended to produce a ban. The Board of Health usually considers things which are potential public health risks, and we discussed them. If we have any way to mitigate the risks, we let the public know. And those are steps that are short of actually enforcing a ban. Also, there was some comments made concerning the fact that the Board of Health is getting into areas which are not really public health. And having reviewed them, I found none that would be qualified to make that statement. There was some discussion about banning gas stoves. This board has never discussed banning gas stoves. We didn't consider it, we wouldn't consider it, but there are risks when you are utilizing gas cooktops and stoves that are a danger to public health. And the only thing that came out of our discussion was we strongly recommended that people use exhaust fans when they're utilizing the cooktops. It involves things like nitrogen dioxide and carbon monoxide and particulate matter, which you really don't want to breathe if you can possibly avoid it. So it would be ridiculous under those circumstances to, actually introduce a ban on gas stoves. They could ban, but it wouldn't be by this Board of Health. It would have to be done by federal or state authorities. So we are not overreaching in that area at all. But in order to answer that and other questions and to address some of the concerns that were expressed by both Mr. Golden and by the town manager, there was a possibility, if we can arrange it, that we might have a joint Board of Health and Select Board meeting during one of the scheduled Select Board meetings during the month of April. I can certainly request that. No guarantees it will be granted. But since the town manager also said he was having trouble keeping up with everything the Board of Health was doing, I think it would be worthwhile if we actually met together and discussed any problems that are being foreseen and discuss any questions that anybody has, so that everybody is very clear about what this Board of Health does and tries to do and what is not true. So if the board members wish, and I would ask for a motion about this, I will send a request in that the Board of Health and the Select Board be granted a joint meeting at one of the meetings on one of the Tuesdays during the month of April. Any discussions?
Just to note that I know they're filling the agenda for April 15th already. So you might not want to limit yourself to April. You might want to say a future. Or the next available meeting or something like that. I just wouldn't want to limit you to April because April may not happen.
Well, we have to have a Select Board member here, or we have a Select Board member that's joining us remotely. The last Select Board meeting that I listened to, they were talking about a meeting before the 15th. I think it was going to be the 8th. Are you still using alternate week meeting schedule?
We're meeting next week.
But their agenda's full. What I'm saying.
But you're meeting weekly.
Full. But I'd like to, thank you, please, talk to the chairman and get on the agenda, because I would like to, I mean, I'm here tonight to get up to speed on the issue. And I'd love to have you, so we can ask about the different things that you're working on, so we get up to speed, that's why.
Mhm.
So. Sure, David was gonna say anything, but, no, I don't, I'm not gonna say completely up to you guys. Except, see the bird, everybody else, yes.
Could Charlie move closer to the table so that we can hear him?
I was just saying that I would love to see a joint meeting because I want to get up to speed on everything the Board of Health is doing. I'm here tonight on a different issue because I want to get up to speed on the tobacco the pouches, and I know that's an issue tonight. So I would love to be able to have them at a meeting, then we can ask questions and they can tell us what they're working on, what they're coming up with. So we can get, as I said, we get the facts and not speculation, and so I'm all for that. And David, I don't know if you know if that's being scheduled.
Thanks. If I can be recognized, Barry.
Yes, please go ahead, Dave.
Thank you, Mr. Chairman. Thanks for your comments, Charlie. I don't know that there is a joint meeting being planned, but I'd certainly be open to that. And I'm sure our chairman would be as well.
Okay, thank you, David. And by the way, thank you for your service on the Board of Health. You were our in-house parliamentarian. And I guess you've taken those duties over to the select board now.
Always happy to help.
And so, I guess what I would ask one of the board members to do is to make a motion authorizing me to request the joint meeting with the select board.
So,
Dr. Reed makes the motion. Is there a second?
I'll second it.
Amy seconds the motion. Is there any further discussion, or is there anyone in the audience that would like to make some statements about this besides those that already have?
Barry, can I say something?
Sure.
Yeah, I feel, so I have a poster in my office from the Mass Health Officers Association that lists 150 things that local health is responsible for. And the work that comes out of the department and the board is wide reaching, to say the least. So I think that it would be great if anybody, public health is definitely misunderstood, and local public health is definitely not understood, how wide reaching it is. So I would love to have a meeting. I mean, you guys know me, I'll talk public health until the cows come home. So I would love to be able to sit with the select board and explain the great work that comes out of the health department and then what the board does.
Okay, thank you, Amy. Anyone else? And I'll just call the roll. So Amy, yes or no to request the
Yes.
joint? Lorenzo,
Yes.
Deb,
Yes.
Dr. Reed?
yeah,
Myself, yes, it's unanimous. I will send an appropriate email in requesting that meeting be scheduled. If not possible during the month of April, then as soon as we can schedule it when everyone is available. Thank you. Now we get to some things that, this is the kind of thing that we like to do. Because this actually involves our students. We have two students joining us, both of them remotely. And one of them is Madison. Madison, are you there?
Yes, I'm here.
Hear you. Okay, you can hear us fine?
Yeah.
Okay, Aaron?
I'm here.
Okay, good. So, there's a lot of information floating around about health risks and the kinds of things that might be important to consider when we're thinking about trying to protect the health of our children and our school-age teenagers. There's data about this. I'm going to see if I can work a miracle and do a screen share to show you some. Let's see where it is. cancer data. I guess it's down below that. There it is. See if that shows up. There it is. So this is what I do. You must understand that I was a former college professor for 36 years and a research scientist. So I'm used to dealing with the CDC and the NIH and a variety of other organizations. So if you look at some of these things, it'll just take a few minutes. You notice the heading on this one says injuries from firearms are the leading cause of death for children and teens. And if you look at the graph underneath that, you see that some of these things have been falling consistently for quite some time. These graphs started in 1980 and continued to 2020. So if you look at the blue line, which says car accident on it, you can see there's a little few blips up and down, but it generally had a downward trend until the most recent years when again it started to rise slightly. The firearms, that's the orange line, and you can see that there was a peak of that somewhere in the 1990s, and then it fell, but more recently, once again, it has started to increase. Cancer deaths, cancer and illness have been decreasing in the younger people, and that's been consistent. Overdoses. Once again, what's been observed is that with overdoses, while they were low for quite some time, recently they have shown an increase, which is disturbing. That's one of the reasons why we're concerned about, any of the high school students starting to become addicted to anything, including alcohol and nicotine. There's the cancers were going down and other diseases such as COVID-19. No surprise there. If you look at 2020, it did go up a little bit during the pandemic. So these are all some of the things that I think, everyone should be aware of. There are some exceptions to this. If you look at 100,000 Black children, and remember, this is not just Plymouth, this is nationwide. Ages 1 through 19, data before and after the methodology change is displayed as two separate lines. This caught my attention immediately, and it scared the dickens out of me, because if you notice what's going on among the Black children, the firearm deaths have been increasing drastically. I mean, drastically. Look at the orange line going up. And car accidents have also been increasing by quite a lot. So there is an issue for Black children, which is even worse than for others. This is a similar sort of demonstration. Shows you the same things you saw before, but now there's some other things that, if you look at the chart, there are things like malignant neoplasm, suffocation, congenital abnormalities, anomalies, heart disease, drownings, fire or burns, and chronic respiratory disease. But the ultimate answer is the same. The worst is the firearm-related injuries, followed by the motor vehicle crashes, followed by drug overdose and poisoning. So this is an ongoing concern in our discussions with our student representatives from the two high schools. They also have pointed out at least two of these concerns were some obvious concern to them based on, their interactions with all the other students that they're with on a daily basis. And one of them obviously involved nicotine addiction. We've talked about that quite a bit. And the other one was motor vehicle crashes. And there was some discussion, since most of you weren't present, about how risky it is for our students at the end of school when there's an awful lot of traffic trying to all exit the school lots at once. And apparently there has been, according to our student representatives, quite a number of minor, I hope minor accidents that were a risk to the health of the students. Some of the other things that worry us specifically and again, this is the US, this is not just Plymouth. The gun suicide rate, and this is also not just for younger people, this is for everyone, is at a near record high. But the gun murder rate has dropped. So again, this is coming up, I guess, at the town meeting as part of the discussion. This is the other thing, the last thing I want to show you was these active shooter incidents, which is a major nightmare for all of us. None of us ever thought we would ever see this kind of thing happening. But if you look at what's happened over the years, although there's been a slight decrease in the last period from 2021 to 2023, there's been an awful large increase from what used to happen back in 2001 through 2009 about. Certainly, although this goes back much further than that, I don't think many of us would remember this ever having happened when we were students in school.
Do you have any information about Massachusetts?
Not on these, but certainly I'm sure that information is available.
It would be interesting to see a little closer to home, because I think that social economic differences would be rampant and vast in some of these other areas of the country.
Yeah, I think so too, because, obviously Massachusetts does have very strong gun laws compared to most of the other states. I'm not so sure that the traffic accidents, car accidents would be that much different. And I would hope that, substance abuse disorders would be better here than they are in a lot of places. But we don't know that. I certainly can get that kind of information for you.
Yeah, because I think the one thing that we don't talk about a lot here, and we probably really should, is prevention. We talk a lot about statistics, but not necessarily what we can do about it. And it's interesting you mentioned seatbelt law, because Massachusetts does have a seatbelt law.
Yes.
And so it's encouraging and enforcing seatbelt use. So that's a prevention. I think that also needs to be discussed as well.
Yeah.
Not just stats from the United States, but more like what is happening here in Massachusetts. We have a helmet law, for kids who are doing bikes or things like that. That's also a part of prevention that's important to mention. Firearm safety, huge firearm safety programs here in Massachusetts. We've had the Grandmothers Against Gun Safety, Against Violence here to speak to us. Mental health support in the state of Massachusetts is outstanding. You know what I mean? So we have a lot that is good here. That's why I'd be really interested, I don't know if the audience would be interested or not, but to find out more about Massachusetts. Because Massachusetts and another part of the country is very different. So I think it'd be interesting if we could, ask Devin Donovan, who's our epidemiologist through the grant. This would be a great project, I think, that maybe I could ask her to take a look at, specifically for Massachusetts. And how the programs that we do have here, prevention programs, how do they compare against the national statistics?
Yeah, I think everybody would like to see that. And Devin seems to enjoy doing that kind of research a lot. We are extremely fortunate to have her. Yeah, if you want to speak, just come up to the.
No, I just, right now on backyard in Plymouth, we just had a presentation last night from my Health and Human Service Director, Michelle Brady. And she brought in, BAMSI was one of the groups that got the opioid settlement. And Mike Kelly, who runs that, spoke, and Michelle gave a wonderful presentation. So right in our backyard, we have phenomenal services. We have, Plymouth is a huge recovery community. And there's so much going on that you don't have to go far to find out what's going on. And just contact Michelle Brady, and you get a wealth of knowledge. And Karen, I know you because because you're part of the groups that she meets with. So you don't have to go far to get those stats. So,
Yeah, I mean, some of the data is not easy to come by because some of it has actually been removed from the websites.
you'd be surprised what's going on right now.
Yeah, and I think, and thank you for bringing that up, Charlie, but through the chair, if I could, I've also mentioned that to the board. I went through a little abbreviated presentation a little while ago about what Michelle and her group has done through Arise. which is the use of the opioid settlement money, which is important because I thought it was important for the board to know how we are utilizing those funds. And I just refresh your memory really quickly, but it was the 5 grants that we gave out to local, and by local, I mean Plymouth organizations that were dealing directly with the impacts of opioids on families and individuals. So it, like Mr. Bletcher said, I mean, it's spot on, it's happening right here. I mean, it is just, you know, and I sent Michelle a text last night after the presentation on the select board meeting saying, this is ground level.
Mhm.
You know, this is like, you can't get closer to what we're actually doing. And so I think that's really important as well.
One thing in the agenda last night.
Yeah,
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 I listened to the whole thing.
yeah, it's great.
We also have organizations in Plymouth, like PYDC,
Mhm.
is very active in the area of substance use disorder and trying to find ways to do it. And there are school officials there, the police are there, there's people from all kinds of service organizations there at those meetings all the time. So, you know, I think it'd be better if we can do it to get the data specifically for Plymouth. Because if you look at the whole state, again, there's vast differences from one area of the state to another.
Yeah.
We can't compare what goes on in Plymouth to what goes on in some of the much worse off communities that have, you know, a lot of issues going on. So I think, you know, again, if Devin, our new epidemiologist, can have time to start to explore that with some of the other groups that work on the same things in the town of Plymouth or even in the county.
That might be easy to get.
County of Plymouth is easier to get
Yeah.
usually. If you start looking for data, you can find county data much
Mhm.
easier, more quickly than you can individual town data. But, you know, yes, Plymouth is doing a lot. I follow what, you know, the police department has been doing in terms of how they handle people who are having struggles with, you know, substance use disorder. And, you know, I know that they are doing a lot of things that are drawing a lot of attention in terms of trying to help those people to overcome the addiction, rather than just throwing them into jail for violation of the law.
Mhm.
And that's not happening in every town in Massachusetts, and it's certainly not happening in every state. So I think it was worth knowing something more about it. And I want to get the 2 students to sort of weigh in on this. And while we're talking to the students, another thing that impacts possibly behavioral health for our student population is cell phone use, which I think is a major problem. And there has been some studies done already where they found that student performance increased quite considerably when some of the local school districts actually banned cell phone use during classroom time. I don't know what the Plymouth schools have done. I don't know if that's been discussed. I don't know if it's been discussed with the students. But Erin, can you fill us in on what happens with these things in the school?
So for the phones, I want to say 3 years ago, South kind of implemented a new thing where we had like these phone caddies almost, or like a pocket. So kids have been putting their phones in the pockets lately. And teachers have been saying that like concentration with the kids have definitely gone up with the phones. But like overall with the younger the kids get, it seems that their ability to like concentrate for longer periods of time are getting shorter and shorter. So I think the cell phone use in school, like as much as I don't want to say it, I think it's more beneficial if kids can put the phone away so they can really sit down and concentrate, even if it's just for a couple hours.
Okay, what about you, Madison, sorry.
I agree. Like I think at North we also had those like caddies that Erin was talking about. It's like our goal at North is to have the students put the phones away while the teacher is talking and like a lesson is being presented, but I feel like it's not as strongly implemented in some classes more than it is in others. And I feel like you can kind of see the difference in students and how they like interact in one class when you know like a teacher's going to make you put your phone away versus like in another class when the teacher might not like enforce it as much. You can kind of see the difference in like their grades or how hard they're like willing to participate or if they like
want to go to that class or if they don't want to go to that class. And I feel like the cell phone, since like our age group has like the technology has been through in our lives, like throughout our whole lives, like we've grown up, but the cell phone's been around technology forever. I feel like that also has the big impact on all the other issues that were mentioned, like the driving, like the car accidents, like just not having the ability to drive the 20 minutes back to your house from school without picking up your phone. Like that could lead to the increase in car accidents in this age group.
Yeah, thanks, Madison. So this is why we have our high school students joining us. Every year now, we have students from the high schools that are invited to, obviously they can't vote, but they can provide us with information might otherwise not even be aware of. The other thing that comes up is most of these students are usually planning careers in either medicine or nursing, or one of the health professions. And having served as the pre-health advisor for decades for a university in New York City, it always occurred to me that you really need to be able to communicate one-on-one in person with the patient population, and with other colleagues. And doing that remotely or by sending text messages or emails back and forth really is not adequate when you're dealing with something that is such a personal sort of service. And I always wondered, are the students losing their skills and their abilities to actually have meaningful one-on-one conversations with others in their age group? And from what I saw when I was still teaching and doing pre-medical advising, they were in fact not doing as well as the older generations were with that. So it comes up. When I was doing mock medical school interviews for the students, I would usually ask questions about, how would you prefer to communicate with your patients and with other people working in the same field? And the answers were kind of mixed. But we've all been to the doctor, we've all been to the dentist. Nowadays, because of financial pressures, what you find is that you might get about 10 or 15 minutes of attention from your healthcare provider. It's usually very rapid, and sometimes they're not very forthcoming with asking probing questions about your health, although they are responsive if you bring up a concern. So, we have to find a way to equip our students that are going to get into the health professions specifically, so that this problem, to the extent that can be kind of resolved or improved, would happen. I'm sure Dr. Reed probably has some things to say about this too.
I actually wanted to bring up, I don't know if everyone saw the article in the Plymouth Independent the other day. And it was an interview with the Curry College nursing faculty, and how they're actually starting to see more people go into nursing, which is good because for a while there was a big slump in that. And I was quite concerned during COVID that might make less and less people want to go into medicine. But they're starting to see that, and I encourage these young people. I mean, this is a field that can be very challenging. Throughout your entire life, you'll always have a good job, and you'll be, an important part of the community.
Yeah.
But you're right, you do need to know how to speak to people.
Yes.
You can't just text them.
I never forget working in a laboratory at the medical school, and I was sitting directly outside of the supervisor's office, the lab director's office. And I was doing something at the computer and she was in her office. And all of a sudden I started getting text messages and emails from her. And my chair had wheels, so I wheeled myself over to the door and I said, "You want to talk?" And she looked shocked. "Oh, I didn't know you were right behind the door." But it's a concern. The other concern, I guess, in terms of student health and cell phones is the idea, and I think we brought this up with our students before, of cyberbullying, which can put a lot of psychological stress on the students. And I don't, as I recall, we brought this up before, two students said that they hadn't seen that going on very much, if at all, in our schools in Plymouth. Is that correct, Madison and Naren?
Yeah, I haven't really seen it. I mean, I know it's there, but it's not really something that's prevalent.
Yeah, I agree
So-
with that.
So I have a question if I could for the chair, for our students. I watched an interesting program on Netflix called Adolescence, over the weekend. And it was about a 13-year-old, young boy who commits an awful crime. I won't give anything away because you find out in the first 5 seconds that he commits an awful crime. But part of the thing that played out was an interaction with his parents and other students about emojis and hidden meanings of different emojis. So, ladies, honestly, if I were to ask you, do you think your parents know what all of your emojis mean?
Definitely not.
Yeah.
I mean, maybe not the ones I would use. But I think if thinking like the student population as a whole, I don't think so at all.
Yeah, I think it's interesting, and I said this to my husband, but I think what's gonna be beneficial, however, is that we will probably be the last generation that won't know that. Your generation and your children, because you grew up with that, I think you'll be more in tune as parents to what those little symbols might mean. But it was quite eye-opening. I recommend it for anyone who is a parent or a person in high school. It's short, only 4 episodes, but it was very thought-provoking, and it had a lot, my husband and I had a lot of conversations about it, and it really does speak a lot to what it's like to be a boy growing up in society today. It's very interesting. But anyway, thank you for your honesty. I appreciate that.
It's one thing we can trust our students to do.
They are honest.
They are extremely outspoken and honest with us. And I think that's a wonderful thing to encourage as much as possible. Does anyone else have anything they'd like to add? Lorenzo,
Nothing to add.
Amy? No, Deb?
No, no.
Okay, well, I think we have to move on with something else, but thought it was important to bring this up and to get some input from our students. Anyone and also people that are actually joining us remotely. I'm looking to see if anybody has their little orange hand up. I don't see anybody. Or is there anybody in the audience that came to the meeting that would like to speak about this before we move on? No? Okay, well, thank you. Now we're gonna move on to,
Peter Brennan.
oh, Peter Brennan is here.
Yes, hand up.
Okay,
For
Peter,
the next thing, though, wasn't
Hey, I was just going to comment on the tobacco regulations, but I don't know if we've moved on to that part of the agenda yet.
yeah, Peter, we're about to talk about that a little bit more because what we have to do now is we have been provided with a model regulation that came from the Massachusetts Association of Health Boards. I think I sent it to all the Board of Health members. I also sent to the Board of Health members our existing regulation from the Board of Health, which I think is several years old now. So what this model regulation has in it is highlighted areas in green and yellow. And I believe the yellow areas are existing wording from the state regulations. Most of them seem to pretty much match what we have. Some of them need a little bit of word changes in the wording. But then there are these green ones, which are the local options that they presented us with. And I know this is gonna come up at the next MAHB meeting, which is gonna actually be held, unfortunately for some of us, on Saturday here in Plymouth in the 1620 Hotel. It's not open to the public, but it's going to be a huge collection of Board of Health members and public health officials from this particular part of the state. They get together once annually. So there are these green areas, which are things that the Board of Health could incorporate into our own regulations, or that might in fact, not want to do that. So, for instance, looking through these, there is highlighted in green a definition of oral nicotine pouches. I know these have come up because I remember David Golden brought it up briefly, at the select board meeting. We've talked about it. We've talked about it with our students. These are pre-portioned pouches containing nicotine and other ingredients intended to be used between the cheek and the gum to deliver nicotine. So strictly speaking, they are not tobacco products. They use something which is called NTN, or non-tobacco nicotine, which is nicotine that is manufactured synthetically. These things, as we mentioned in previous meetings, had been being produced and still are being produced in about 20-25 different flavors. Usually the flavored ones are designed to appeal to younger people. Since this happened, and also something similar to that happened with the vape liquids, they were also being produced in a bunch of flavors that would be appealing to younger people. The state has now banned the sale of those. So you can no longer purchase either nicotine pouches or vape liquids that have a variety of these flavors, which apparently was a developing problem. Our students told us, previous students told us that vaping was a big problem in the schools. And now apparently the vaping is tapering off, but there is a number of students using these undertongue nicotine pouches. Trouble is, it's a health risk. First of all, it induces nicotine addiction, which is one of the most difficult addictions to get over. And sometimes it leads to addiction to other substances as well. So you know, that's a problem. It's also possible to get so much nicotine that it actually can be very, very harmful, and in some minimal cases, lethal. So nicotine, as we discussed last time, I think with Peter, it is not a carcinogen. It doesn't cause cancer, but it is a tumor promoter, which means that if you've already have a tumor developing in your body somewhere and you're using nicotine products, the nicotine can encourage and cause an increased growth rate in the tumor itself. So it's not without risk. Yeah, we weigh this against what goes on with, getting past nicotine addiction. How do you get past nicotine addiction? Well, some people say that the vapes and also the nicotine pouches are much less risky to the user. That's probably true because they don't contain as many of the other chemicals which are known carcinogens that cause cancer. But if you look at what the FDA says, the FDA does not recommend the nicotine pouches as a way of getting over addiction to nicotine products. They do allow nicotine pouches to contain up to 6 milligrams of nicotine, but not above that. And as I recall, Peter, when he talked to us last time, said that, well, most of what we sell has actually got 9 milligrams of nicotine in. So we have to consider all this. So what are we going to do? How are we going to word our own regulations so that it conforms as best as we can to the state regulation and to what's, obviously preferable for health without doing undue damage to the commercial businesses in the town. So it's not an easy job. We don't have an easy job on the Board of Health. It is probably one of the most difficult, certainly during the pandemic, it must have been one of the most difficult boards to serve on. But we have to do that. The other things that came up with this was the possibility of what's known as generational tobacco laws, which meant that if adopted, no one born after a certain date would ever be able to purchase any nicotine or cigarette products. This we discussed briefly, but not for very long. The Board of Health previously decided during our discussion that this is someplace we don't want to go. We just don't think it's appropriate, for one town's Board of Health to get involved in this, although other towns have certainly done so. So, Amy, if you're there,
I'm here.
I think you mentioned that now there's what, 14 or 16 towns that have adopted this generational tobacco ban?
Yeah, I heard Somerville did a couple weeks ago too. That was the biggest one.
So what happens when you do this? What it means is that gradually, year after year, less and less people become able to actually purchase tobacco and nicotine products. So it's a gradual reduction. The advantage to the businesses is that you don't have to keep changing the dates for when someone is eligible to purchase or not. There is one date and it never changes. So if you wait a generation, which was 20 years, eventually there'd be very few people left who could still purchase the tobacco products. What's going to happen with this, I don't know, but it is actually in the text from the model regulation as one of the choices that has to be put on the local boards of health to decide on.
Ben,
Yes,
excuse me. Lorenzo asked if you could put that up on the Zoom.
I think I can. See if I can share that one. No tobacco sales. Okay, so as soon as it comes up on the screen, there it goes. So this is, it's a lengthy sort of thing, so I'm gonna have to skip through it until I find it. There's a lot of small things in here. There's the definition of nicotine pouches. Tobacco sales permits. Probably nude. Hope I don't go running past it. Is the oral nicotine pouches. There it is. Sale of flavored tobacco products prohibited. You notice most of that's in yellow because the state has already done this. There's nicotine content and electronic nicotine delivery systems. The state has already done this. This thing is about blunt wraps. I'm trying to find the one we're talking about now. I think I ran past it. Tell me if you see it as I go.
What page are you on? Yeah, just look at the page numbers.
Yeah, that's the best way. It's page 7.
Okay.
So there it is. No tobacco sales to person under 21 years of age or born on or after January 1 of some year. I mean, that's the choice that they're actually putting up for boards of health to consider. And the bottom part of that, all it says is no retailer or person shall sell or provide a tobacco product to a person under 21 years of age or option born on or after January 1, let's say 2026. So we have to decide that. It's not an easy decision to make because you can argue about that a lot. But again, we are faced with the challenge to make our requirements and our regulations as safe for our population as possible without doing undue damage to our local businesses. It's not easy, but we also consider what's going to happen. If we did this, what would people do who were no longer able to purchase cigarettes? They buy them online or they go to some other adjoining town. So I think our philosophy as a Board of Health was, this really doesn't belong to us in the regulation for an individual town like Plymouth. It's something that the state should do. And if the state doesn't want to do it, it doesn't make sense for us. Of course, other towns, apparently 14 or 16 of them have disagreed with that. But we did discuss this. We haven't done anything about it yet because we want to discuss it in great detail before we do. So that's another thing that came up from this. The final thing that came up from this that was a charge that I think we have to look at is under violations. So I guess that's on page 12. Violations. So in yellow, you see what we do now. The state mandated that an underage sale of any tobacco product would incur a fine of $1,000. And that if there was a second violation, it would increase to $2,000. And if there was a third violation, it would increase to $5,000. And any violation beyond that would also induce the Board of Health to look at what we put in place, which was a suspension or complete revocation of the sales permit. So in some cases, the state has guidelines. You have to fit it in with a certain length of suspensions. And we did so. So we already have that in place. And apparently it has been very effective because we've noticed, I don't know if it's changed, Karen, since we did it, but I think since we were forced to actually withdraw the permit from one vendor, one sales location, the number of violations we see for underage sales has dropped.
Definitely.
The other thing we have to talk about is what are we going to do about the nicotine patches, the oral patches? And I think you mentioned that our underage tobacco sales inspector had told you that there was something going on in terms of the reports that he was filing about the Plymouth.
Then,
The ZINs.
the pouches,
Yeah.
right, pouches.
So I wasn't sure if that is now been incorporated into the state law. I don't think it has.
I didn't think it was, that's why I asked, Bob for clarification as well, because I wasn't sure what we were supposed to do with that.
I mean, if it's a state law and there's a fine associated with it, we can't do anything about it. That's the fine, the state says that's it, there's a preemption law, local communities don't have any option. But when it comes to the suspension limits, the timing of the suspensions, and the point at which the sales permit is actually revoked, that's within limits up to the local boards of health. So the other thing that they did in the model regulation is they incorporated both the penalties from the violation of the state laws. And those are the ones you just heard about. But then they listed in another column violations which are not part of the state law, but which may be part of the local regulations. Those would be accompanied by a much lower fine. And there's a list of those. We don't have to incorporate that, I don't think. We could do it if we wanted to, or we could decline to do so. So there's basically those three things that I think the Board of Health has to consider when we start talking about what do we do? How do we change the regulations? Which of the regulation changes they're suggesting do we want to incorporate? Which ones do we not want to consider? And that'll take some debate, and that'll take some input from, the people in the town, people that come to our meeting. We had a public forum about it. And I know, Peter is up there someplace. So the first thing I'll do, with this, and we're not gonna vote on this today, it's a heads up that this decision-making process has to be discussed, and we have to get input. We already have some input from it, from the public forum, before we make any changes to our regulation. Also, at the select board meeting, something came up about bylaws versus regulations. Bylaws, can't easily be changed, because it has to go through a very lengthy process, which can take years. Regulations, on the other hand, can be amended just by a majority vote of the board. And we can do that, and we have done that. What's going on, but something's happening. It's my phone, which I thought it turned on. No, I don't want to. I don't want to talk to you right
David
now.
David has his hand
So, we start taking some input now, but obviously there's got to be no vote. There's got to be more internal discussions with public input before we can do any of this changing. David, did you want to say something?
Thanks, Barry. Yeah, I just want to correct the record. Bylaw changes do not take years. After a town meeting vote, the state has to turn it around back to us within 90 days. So it's a very short turnaround time. Thank you.
You're welcome, but you know, the problem is that the town meetings only occur twice a year. And usually depending upon how you actually time it, what has to happen is, you know, David and everybody else, I'm sure, Charlie knows too. What happens is if you want to put in a bylaw, it has to become a warrant article. If it's going to become a warrant article, then it has to go before advisory and finance, it has to go before the select board, it has to go before the various precinct committees. And somebody who's putting this forward has to appear before all the precinct committees to discuss it and to answer questions. So if you think about all the steps that are involved here, you could easily miss a town meeting, because the deadline is gone. Or, you know, you might just make it, but you don't want to do anything rash. Best example we have is when we put in the regulations about short-term rentals. That, as some of you know, was an extremely lengthy process. We met with the select board appointed subcommittee, I don't know how many times. We worked on that, tried to find common ground, and eventually we were told, you know, well, this should be a bylaw. And then I think we consulted town council, and there was going to even more complications because it was going to involve the zoning board of appeals. And so the town council actually said, at least initially, you're better off doing this as a regulation. Because you don't have to go through such a lengthy process. And we did. And all the members of the select board subcommittee, which included some people that were actually running short-term rentals, and somebody from one of the, I think, the hotel industry, everybody agreed. We found a way to actually make a common ground so that everybody, regardless of whether you came from the short-term rental group or came from the public health group, actually agreed. We put that together, and it became so well known that Karen actually gave a presentation about that to a local meeting of the Massachusetts Public Health Association, or the Massachusetts Association of Health Officers.
Yeah.
So we were the model.
Amy has her hand up.
Amy, go ahead.
I just wanted to, so one of the things you mentioned, Barry, was that the board decided that if the state doesn't pass the nicotine-free generation, then that wasn't for us, which I just want to, I don't think nicotine-free generation is for Plymouth, but I do feel like the laws around stricter tobacco definitely start locally. Like if you look at back in the history, when you think about the workplace, smoke-free workplace, that all started locally, and the state won't do anything until there's enough momentum from the state. They did that, or from the locals. They did that with smoke-free workplace, and then they did that with 21 plus, and then they did do it a little bit more aggressively with flavored. But I would say, you know, I think that the locals are the ones that are making the movement and making the statements and passing things forward. So I don't know if I don't think you'll get the state to do anything until they see enough local support.
Yeah, you're probably right, Amy.
No, it definitely, history shows that for sure.
Yeah.
I mean, even with our polystyrene ban that we just passed for takeout containers, before we did that, there was about 62 communities that had already done it. So the number was growing, and I just looked at all the public health bills that have been presented to the state legislature during this legislative session. And there is in fact a bill which would ban polystyrene takeout containers at the state level being considered for this year. So what Amy said is correct. If there's enough local communities that do something, they don't want, you know, wide variation all over the state, community by community, because it just doesn't work. So they would rather have it uniform. Lorenzo, go ahead.
Yeah, through the chair. You know, I wanted to agree. I'm just agreeing with Amy's comments on how local boards of health really lead the way at the state level, whether you're one of the 50 states, right? Massachusetts or any of the other states, but local boards of health, you know, through, and I'll use the word philosophically loosely, but there is mass general law that supports the authority of regulating public health pieces or items at the local level, and they have that authority, and that's where you get into local boards of health, um, ideas of whether they're hyperactive or not active, but they do have authority as given through the authority of Mass General Law. So that's my
Yes,
comment.
Thanks, Glenda. Yeah, we're all aware of that. I'm sure even the select board and the town manager are aware of that. The Board of Health is almost unique in that it has a lot of autonomy. Just because what we do is things that have to be done quickly. And we're fortunate on this Board of Health to have an awful lot of people with high qualifications in the fields of health and science. Yes, yes, you can.
I'm sure, I don't know if you're gonna listen to the businesses tonight, but I can just say as a select person, I have a lot of respect for this board. The knowledge you have on it, you guys are professional people, and you know, that being said, we're a unique town, which I think I've heard that. The state, if the state regulates something, it's a lot easier for, I guess, for the businesses to be able to handle. And I know you don't like to use the word ban, I hate the word ban, but, you know, kind of handicap of the businesses. You know, when we, like the poly, the styrofoam, that was easy because that was talked about a few years ago. The vendors actually stopped, most of the restaurants, and I'm very close to the restaurant, we stopped using this a few years ago. When it finally it's done, nobody uses it anyway. So it was good. We talked about it a while ago. And so when it finally went into place, it was a no-brainer. We had a nip bin. Okay, and I don't want to even bring that up, but the residents voted not to support the nip bin. And that was gonna really impact businesses. And the reason being is because they can go the next town over, Warren, Kingston, get Wareham, and get the nip. So all it was gonna do is take the business away from the Plymouth businesses. And they were gonna go next door and spend their money. And the businesses showed us that they're not just gonna buy nips, they're gonna buy everything else, lottery tickets, everything else. So it's gonna be a lot of money. It's gonna cost the businesses a lot of money. You know, that's why I get nervous. And then I know you were talking about these different considerations. And one of them you talked about was, well, just only let adult tobacco businesses sell these products. So my question to that is, well, I was gonna ask you this if you started to talk about it, but anybody that sells tobacco products, responsible businesses should all be carded. They should be carded, so you have to be a certain age to buy tobacco products. So I don't know the difference between selling it in a convenience store or an adult tobacco store, because you can't buy them unless you're of age. And we just heard tonight, $1,000 first, 2,000, and then we've had one business. And I know because it came before the board, their license was revoked. And I'm gonna tell you something, that is probably costing a lot of money for their liquor sales, because people are going other places to buy those products. And that right there is proof of how much losing tobacco products hurts business. So any business out there that's selling tobacco products that doesn't get it, that you're gonna be very serious about, you have to have a mandatory. I give my license every time I buy jewels for my wife. I gotta present my life. I'm 68 years old, and I love doing it because that's their system. You can't sell it unless you scan my license. So So the solution to just put an adult, I don't think that's a good solution. All it's doing is helping those adults. Whatever those vape stores, I'm not even sure what an adult tobacco store is. But all you're doing is helping that one little industry, but you're hurting all the convenience stores and the other places that sell it. So there's a lot of responsibility you guys have here. This is something that I get. I wish nobody used nicotine. Nobody, but it's it's a reality. People are out there. And so some people do it legitimately. They do it because they want to stop having smoking. So they do the nicotine. I guess it helps their cravings. I don't smoke, so I don't know. But your responsibility is, I know it's health. You got to make sure, but there's a lot of unhealthy things that we ingest in our bodies. That we when so as long as it's legal, I think we got to be real careful in how we regulate. The state is, and the state has got to do a better job if it's this serious to regulate this stuff. But right now, we're just hurting, we're going to lose business to other towns and revenue that we need for this town. And we get a lot of family-owned businesses here. I just look right out in this room right here. And they have employees that live in Plymouth, and they depend on their sales. So I just encourage you just to be very careful. And like I said, a lot of respect for you do, for what you do, and I support it. I also support the businesses too. So
Yeah, right.
thank you.
We are very conscious of that kind of thing. An example of that, Charlie, is that some of the towns have actually banned the sale of polystyrene packaging materials, which is really
I'm
annoying
not
stuff.
sure what that entails,
But we thought about that too.
and it's the vendors too, as far as that industry goes. When the vendors realize, they start coming up with different products that
Yeah.
are accepted. So,
So what do you do? You can go and buy polystyrene at any time. Home
Right.
Depot's, Lowe's, any place. What good does it do if we ban it?
like I said, you have a temp, yeah.
Yeah, we do. Amy? Amy?
Yeah, to Mr. Bletzer's point about keeping tobacco and products away from minors, which is our goal, right? Like that's the Board of Health goal. But the last year, when we had the tobacco compliance checks, which only happen once a year, there were 19 stores that sold to minors. So I do feel like this would be a whole different conversation if we could say that out of 43 permit holders, nobody sold to minors, and then we would know people were following the law. But because of that, I feel like it needs to be, considered that not everybody's doing their job when they check. There are some, but almost half aren't. So what do we do on that level? You know what I'm saying?
Yeah, I know. So we're kind of running out of time for this, so there'll be more discussion about this, obviously. I would just ask the Board of Health members to concentrate as they look at the model regulation and our current regulation, to decide what options they want to discuss for possible adoption by our regulations and which ones you don't. And we'll get to that at another meeting. So I thank everybody who participated in the discussion. I think that, there'll be more discussion before anything changes, that's for sure. And yes, we appreciate the fact that you recognize this is not an easy job to do. We found that out the hard way during the pandemic. But, because of the actions we took during the pandemic, the Board of Health and both Karen and I personally received commendations from the State House and the State Senate. So they know what goes on down here, they know how hard it is, and they appreciate the work and the difficult things that the boards of health and the local communities have to decide. Next item of business is going to be.
Thank you for listening.
Thanks, have a good night. Thank you.
You can stay for this.
Rides with.
Thank you.
As soon as the room clears, we'll do the director's report.
Thank you.
Right.
Okay. So, a couple things I just want to touch on tonight. Avian flu, we have removed the electric signs that were around town, but we've moved them to our town field and parks. Because, yes, the numbers have dwindled, immensely, by phone calls and bird locations that we're finding out about. However, there still does remain a, health concern for avian flu with feces. And because we are opening all of our, well, we have opened up our fields and our parks on March 24th. I just felt it was really important that we still have that, communication going with folks who are using those areas. Basically, still keep all your domestic animals away from, any of the feces, remove your shoes before entering your house. In case you pick up something when you're running around, clean off the bottom of your shoes and remove and wash any active wear. Again, this is really not for human concern. It's really to limit exposure to your domestic animals because especially cats. Measles. So I've recorded a public service announcement. It's running on Local Scene, which is a local government channel. I don't go into anything about anything that's politically driven or talking about vaccinations. I do, however, say that measles is a highly contagious disease caused by a virus, what the symptoms are. That it may appear to be any type of respiratory illness until 4 days later, when you are covered with a rash. What is also really important to know for everyone is that measles is really easily spread, almost more than any other disease. It can take 10 to 14 days after exposure for symptoms to appear, and the virus can linger in the air for up to 2 hours. So people say, well, what's the big deal about measles? Well, let me put it this way. You go to the airport and you go into a stall in the bathroom and you go to the bathroom. The person who used the bathroom before you had measles, they sneezed, they blew their nose, they coughed, any other type of activity, for 2 hours, that virus lingers in that location. Now think about you're at an airport, how many people are coming in and out of that stall. Now, the good news is if you've had both vaccine series, you are 97.7% immune to measles. It's the folks that don't have them that we're exceptionally concerned about. So you'll be, if you happen to catch that, it will be me telling you all of this.
Let me add, because I just saw this today, the current count of measles cases is 422 in Texas.
Yeah.
And now it's spreading into the middle part of Texas, not just the western border. And so it is spreading.
It is spreading, and travel obviously contributes to that, you know what I mean, in airline travel and all different types of travel, because it is contained areas, which we saw a lot how it spread with the pandemic as well.
Did you mention anything in your advertisement about cod liver oil? The use of cod liver oil, vitamin A?
No, I didn't, though I have heard of that, but we also got notification not to encourage that.
No, not.
Okay, okay, yeah.
And that people really need to talk to their doctors before.
Well, I definitely said that.
Vitamin A.
Yeah. I said, measles can be confused with other diseases. The only way to verify is to get tested. Testing is performed through a nasal or throat swab. It could also be through a blood draw. And if you have concerns, obviously contact your doctor. And then I give the website from mass.gov. So I'll keep the board posted if anything changes here in Plymouth. And then the other thing I wanted to mention is rabies. There's a low-cost rabies vaccination clinic happening this Saturday from 10 to noon at the Kingston Animal Shelter. So I'd love to share that information for folks who do have to get a rabies vaccine for their cat or their dog, but would like to save a little bit of money doing that. And the animal shelter, Kingston Animal Shelter's phone number is on the next page. The Public Health Excellence Grant, Devin Donovan, who is our epidemiologist, will be working with an intern for the local health internship program. The intern with Devin will be creating a communication inventory by reviewing, capturing, and compiling current healthcare providers in the 6 towns served by the Southern Plymouth County Public Health Excellence Collaborative. And that will serve as a resource. As we really don't have something like that. We don't have a go-to collection of all types of providers. So this is what this intern will be working on with Devon. And then as far as the Public Health Division, 364 renewals were sent out via OpenGov that represents 13 types of permits. Margaret Coe, our health agent, has worked diligently to bring all food establishments into compliance, as you can see tonight, with fats, oils, and grease regulations. There are 25 establishments that do remain out of compliance and will be fined. And this concludes my report for tonight.
Yeah, thank you, Karen. Any questions? I don't see any little orange hands. Okay, chairperson's announcements. Because I was appointed to the NDCAP committee by the state Senate president. That's the Nuclear Decommissioning Citizens Advisory Panel. I do attend all the meetings now as a member. Just to let you know what's going on there, they still cannot dump the radioactive water into Cape Cod Bay. Feeling the decision by the Department of Environmental Protection. They are, however, evaporating some of that water into our air. From the 23rd of November until the 20th of September, they evaporated 72,405 gallons of that water into our atmosphere. There is currently something like about 800,000 gallons of that radioactive water still to be disposed of. So the good news is they apparently have turned off the heaters, which cause enhanced evaporation. They were maintaining the water at 90 degrees. Those are no longer turned on. And the water where those heaters were placed is actually in the next month going to be drained out of the pools and put into something called a torus, which is a storage area. And the heaters will not be used in that storage area any longer, or at least Tech says they have no plans to do so. So it may taper off some. Board of Health meeting in May. It would either have to be the 7th or the 21st of May. I will be away, so I will not be able to chair the meeting. If you choose to hold the meeting on the 7th, I will be here to do the agenda with Dr. Reed and Karen. If it's the 21st, I won't be able to do that. That's the only trip that my wife and I have planned. I don't think we're going anyplace during the summer. But she may change her mind about that. I can't predict. I just go with the flow. So please, if you can, it would be good to set the date either the 7th or the 21st tonight. If you know your schedule, if not, it would have to be done by email. So Lorenzo, are you free on the 7th or the 21st of May?
Yes, I'm free either date. 7th is fine, but I had a question back to the NDCAP report, if I may.
Yeah, go ahead.
With respect to the evaporation, do you have any indication which is more unhealthy as with respect to dumping into Cape Cod Bay or letting it evaporate?
Well, there is a third choice.
Just
the third
if
choice
you
was
know.
done with the nuclear reactor in Vermont. They shipped all their radioactive water to a disposal facility, I believe, down in Texas. That, of course, is also the most costly option for the whole tech company, so they're trying to avoid it. In terms of the other two, there's some debate about that. But some science people who are knowledgeable in radiation biology feel that it's probably more risky evaporating into the air than it is to dumping it into the bay. But neither one is good in terms of public health.
Right.
So more, remains to be seen what happens. There's all kinds of things going on that pertain to that.
Right, because it just seems, at least to me, hard to think about when the state, I guess, stopped the dumping into the bay, but they didn't on the evaporation.
Well, they claim that there is no current state law that directly prohibits that. And that, the nuclear advisory, not advisory, but the national, radioactive, group, that makes those decisions for at the federal level, said that what they're doing is perfectly permissible.
Okay, thank you.
Okay. So, let's see, Lorenzo said good for either one. Amy, what about you?
I can't do May 7th. I can do the 21st.
Okay. Deb, what about you?
I can't do the 21st, but I can do the 7th.
Dr. Reed, it's vital that you be here because I won't.
Do either.
You can do either. So we don't know about Meg because she's not here tonight. So we will follow up on this by email to see if we can figure out which of the dates would be preferable. Obviously, regardless of which date is chosen, at least one member of the Board of Health will not be available. In addition to myself.
I
And
could
remember
be available to 6 o'clock on that 21st. So I could be available for an hour, but
Okay.
just, you need to know that, okay.
Okay, thank you. So I'll have to communicate with Meg to see what she can do also. The last thing I wanted to show you, under this relates a little bit to the, stuff going on at the Holtec company. Let me see if I can get this thing to go. Okay. This is, a long-awaited page out of a very lengthy, cancer incidence report that the state does town by town. This one covers up to 2020, so it's 2016 to 2020. They do it in 5-year increments. We've been waiting for this, and yes, it's 5 years old now. We've been waiting for this and trying to get the data released for years, and they finally did it. So if you look at Plymouth, you notice that some of these things under where it says SIR, that is standard incidence ratio. And if it's highlighted with a gray background, it means that it is highly statistically significant above the expected level. So if you look at urinary bladder cancer, it's a problem in Plymouth. If you look at brain and nervous system cancer, it is apparently quite a problem in women. If you look at liver leukemia, it is a problem in men. If you look at melanoma, it's a problem for everybody, but that's to be expected here in Plymouth. If you look at thyroid cancer, it's a problem in women. And if you look at all sites and types, we are statistically above average for the state in cancer, period. So what does that mean? That means that cancer is an issue in Plymouth. We already knew that. It's worse in Plymouth County than any other county in the state. But again, the increased levels of cases, although significant, isn't huge, but it's a big concern. And so, again, this is a project for our epidemiologists. If you see something is high in your town, the first thing is to find out what it is, and the second thing to do is to find out why. And so you have to do a lot of data analysis to try and figure out what could be causing these cancer incidence ratios to go up. The other good news is while cancer incidence is going up, the death rate for cancer is going down. So just to let everybody know what's going on with that. Last thing I wanted to do tonight is a new or old business. I promised 2 members who are still here waiting patiently that we reserve a little bit of time for them to explain what the study they're doing over at Hedges Pond is and what they need.
It's
Yeah,
very
very important.
I'm Michelle Christensen. I actually left a message for Karen today, so, there's the choice. So, over the last several years, Little Herring Pond and Great Herring Pond, we have been dealing with algae blooms as well as cyanobacteria. So in partnership with the town, as well as the, Marine Science and Technology, school, we ran a study and to find out why we were getting these blooms. Which the blooms are such that we basically shut down all recreation on the pond as well as danger to animals and humans. It's very dangerous. So no activity happening on those ponds. One of them is a great pond within the state. So and there's a lot of fish and wildlife around it. And it has a long heritage, of course, with the tribals. So, the investigation, provided several points, and one of them was, long-term, what could you do? Short-term, what could you do? But one of them said specifically that 47% of the phosphorus that was being generated was coming from septic or sewage. And so we could go off and do various things. We have various projects, tackling it, short-term, we could try to remove the phosphorus out. We're hanging things on Carter's River and doing various activities. I took a little piece of the project and said, if we're looking at the terrain around the pond, what way does the groundwater flow and all of that, and which of these homes around the pond contribute to this water flow into the pond. And we got results back from the study showing us, around the pond, the areas in yellow, that is the septic that would be flowing, as well as Little Herring Pond. That is the septic that would be flowing into the pond. I took using readily available information, all the properties, went and looked at each street all around, grabbed them, basically 547 homes. So that's the northwest part of Little Herring and the west side of Great Herring Pond. 228 homes around Little Herring Pond, 319 residents around Great Herring Pond. Worked with your archivist to pull records for pumping over the last 5 years, or Title V's. And Margaret was very kind to point me over to the archivist. He could give me the information I needed. So for every one of these homes, I created a nice little spreadsheet, went through and assumed, since the recommendation by the EPA as well as the state is every 3 to 5 years, you should pump your septic cesspool, obviously, every year, as well as if you have a disposal on your system, it should be every year as well. So I used the ready available information we have as engineers to know this, and I went through and looked at every single home, it took hours. There were a total of 281 homes that had not been pumped in the last 5 years, basically since COVID. And 51% of all those homes. So little education is needed. Created a nice little trifold. We've been sending it out into our newsletter for the Water Association, Great Herring Water Association. And this is just your EPA, and it tells you why. And other than the most expensive item on your home, costs more to replace it than it does a heater or a water tank or any of that kind of thing. So make them aware of that. The next thing, of course, was to see if we could, as the Association for Herring Pond Water Association, how could we be of help to send out reminders to these 281 homes that we're not looking the whole town, we're looking specifically, kind of selfishly, directly on what impacts our ponds we can do. Of course, there's a lot of other ponds where eventually we could start small here and see where we go, but so we wrote up a nice little reminder letter, and we're willing to stuff envelopes, to cover postage, to run the copy, but we would like the letter to come from the town. because we don't feel that as a volunteer association, we should be the quote unquote reminders of, something that. So we recognize, there's only so much bandwidth in various departments in the town. So we've got the volunteers, we can help, what can we do, as well as, on this, so. That's where we're at, so we're looking for.
Director of Public Health.
Nice to meet you.
Hello, I did get your message today.
Thank you.
I would not send that just to, from my department, I
Right.
could not just point out one location to do that.
Right,
If your group wants to do that, then that's fantastic. I, as the department for the entire town of Plymouth, couldn't just highlight one area to send that out to.
okay.
Because I cannot mandate someone to pump their system. It is not a
no.
mandate.
Oh, yeah, no.
I said, it's your education, it's educational
Well,
based.
it's
Yeah.
two things. It's a reminder that your system should be pumped. I
Mhm.
mean, it literally says, our records indicate that, we can see you have not been pumped. That's it. That's the only, because we know the pumping tickets. We also say it is possible that the pumping vendor has not turned the ticket into the town. If you feel you've been, whatever. We're trying to educate them that, yeah, there's no regulation that says you must pump, but at the same time, there's some good guidelines and recommendations that you should. And we tell them, obviously, other than replacing your system, because if you don't pump, it can break down and fail over time. And the second one, of course, is the runoff, whether it's from fertilizer on the lawn or it's from the runoff coming through the septic or the cesspools. So I recognize.
So
you know,
I would
that-
make, I would make a recommendation that pumping is not nearly as important as pinpointing who has a cesspool.
Yes, we have that information.
So
yeah.
I actually would then, through my department, I could send a letter to people that you have recognize that only have a cesspool, because that does have to be brought into compliance within 2 years.
Oh,
Yep.
unless they have a variance.
So you get a bigger bang for your buck
Yeah.
if we actually do that path than telling someone they have to pump. There have been houses that I've come across that haven't pumped in the entire time that people have lived there, and their system had no damage to it whatsoever. I think what we need to look at together, and we can send something out, will be the people who have cesspools.
Okay, thank you, I appreciate that, because I did walk.
Because a cesspool has no,
Yeah, no.
it doesn't go anywhere
Exactly,
except into the pond.
exactly,
So that's where I think we have to stop.
okay. All right, so that's a good start, and,
And you and I can certainly meet.
yeah, I would love to,
Mhm.
so we can do that. I came here to kind of make you aware of what we are doing here. And then I think also, obviously, the results of the study were pretty clear that, the best long-term strategy is sewage, getting this right. And that's a lot of money. Because I think the nearest one is Red Brook. If there is even
Well, I mean, there's a lot of things we can talk about, but
Yeah.
one is a small sewer system. Like Redwood does,
yes,
but it could be for your neighborhoods that are around the pond. But again, that would be a betterment, that would be having,
yeah.
everyone would be on board to spend that type
Oh,
of
yeah.
money.
yeah,
But that is definitely something to be considered. I mean, that does come up, especially when the state required the Cape to do nitrogen reducing septic systems.
yes.
So who's to say that might not start creeping up our way? So these are definitely things that definitely need to be considered. So I will definitely work with you to do that, but I'm saying skip the pumping. It does not damage the system like you think it does. And let's really focus on who has a cesspool,
Okay,
Yeah,
because
I'm Don Williams, I'm the president of the
Just
association.
not-
One of the other things that we thought would be useful is to start with small skip, Karen, and then see if it works. If you wanna do it with the.
I'm saying, why don't we go with something that we can actually change? You can advise someone that they need to
No,
pump
I
their
agree.
system, but there's no authority that says that they have to. There is an authority, me,
yeah,
that can tell someone they must upgrade their septic system within 2 years, because we have now been notified that they have a cesspool. So that's, I think to me, that's gonna give much more of an impact to what I think you're trying to do than just
Okay.
reminding.
All right, good. So, I'll call you again and
Yeah.
we'll take this because I know you're running late with your meeting and all that.
And we can certainly still talk about pumping. I mean, I could put it in my director's report. We can put it on the agenda if Dr. Parkman agrees. Dr. Parkman and I, we put the agenda together. It could be an agenda topic. I have no problem talking to you if you want to have a meeting in your neighborhood. You know what I mean?
Yeah.
And I can come and speak to something like that, but I'm just trying.
Because a reminder, whatever the tone is, I lived west in another town.
Oh, yeah, do you want to be friendly first?
And, well, it wasn't, no, we literally got a reminder every 2 years. And it was just they had no way to regulate it. But it was something that came from the town and it was like, oh, wait a minute, yeah, it's been a while, we better do that. And it had, so maybe it has an impact, maybe it doesn't. However, the specialist from the report pointed out sewage or septic, point blank, obviously. And some of them, are very, very close to the pond. And there aren't holding tanks, as I was telling you, in some cases, some areas require, when you're that close to the pond. I know of a cesspool that's about 15 feet from the pond.
Well, that's
He's very
happened.
proud to show.
Well, that's what happened here in Plymouth, when
Yeah.
everyone,
Yeah, exactly.
built summer homes around our 364 ponds. And they thought it was okay because they only used them temporarily in a
Yes.
very short period of time out of the year, not to have large septic systems. But then what happened was these cottages turned over to be full-time residences,
Mhm.
but still left what their septic system was before, when it was a seasonal property, to be the same as it is now that it's year round. There lies the problem.
Yes.
There lies that Title V, which is state law, gives us the leverage to say, you do not have a Title V compliant septic system, you need to correct that.
Okay, very good.
And we can work with them with community development, because the good news on that side is
Yes, the homes.
community development has the right.
Homes.
Yep, so we could all put a nice little
Yeah.
package together.
Thank you. I will follow up with you
Sure.
so that we can
Yep.
find out.
You'd think the people that live there would be conscious of the fact that those blooms probably detract from their property value and their enjoyment of their own property.
The elephant in the room. We don't necessarily say that, but I think people do know that.
Of course, yes. But some of the homes are not directly on the pond, but the topology of the land is such that
It's a ball shape.
yes, exactly. And you're dealing with wonderful, wonderful sand, which is great, and many of them don't even realize that you're also have water coming from that same sand where, yeah.
Mhm.
Well, thank you. I appreciate it. Thank you for the
Sure.
opportunity.
Great.
We've been having a very long, many years long battle to try to get rid of as many cesspools
Yep.
as we can. So,
I just want to say good job, good work on their part.
Yeah.
Yeah, for sure.
so we're only about 8 minutes over. All I need is a motion to adjourn. Dr. Reed makes the motion. Is there a second?
I'll second it.
Amy seconds the motion. Lorenzo, yes or no?
Yes.
Amy,
Yes.
Deb,
Yes.
Yes.
Dr. Reed, myself, yes. The meeting is adjourned.